The 2019-20 coronavirus pandemic is an ongoing pandemic of coronavirus disease 2019, COVID-19, caused by severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. The outbreak was identified in Wuhan, China, in December 2019. 4. The World Health Organization declared the outbreak to be a public health emergency of international concern on January 30, 2020, and recognized it as a pandemic on March 11, 2020. 7-8. As of April 20, 2020, more than 2.41 million cases of COVID-19 have been reported in 185 countries and territories, resulting in more than 165,000 deaths. More than 632,000 people have recovered. 5. Although there may be a possibility of relapse or reinfection. 910. MW parser output. Excerpt. Self-link font weight normal. MW parser output. Excerpt indicator border left :3px solid hashtag C8ccd1, margin :1m0, padding left :1m. The virus is primarily spread between people during close contact, c, often via small droplets produced by coughing, d, sneezing, or talking. 11-12-14, while these droplets are produced when breathing out, they usually fall to the ground or onto surfaces rather than remain in the air over long distances. 11-15-16, people may also become infected by touching a contaminated surface and then touching their eyes, nose, or mouth. 11-12, the virus can survive on surfaces for up to 72 hours. 17, it is most contagious during the first 3 days after the onset of symptoms, although spread may be possible before symptoms appear and in later stages of the disease. 18, common symptoms include fever, cough and shortness of breath. 19, complications may include pneumonia and acute respiratory distress syndrome. 20, the time from exposure to onset of symptoms is typically around 5 days, but may range from 2 to 14 days. 19-21, there is no known vaccine or specific antiviral treatment. 11, primary treatment is symptomatic and supportive therapy. 22. Recommended preventive measures include hand washing, covering one's mouth when coughing, maintaining distance from other people, and monitoring and self-isolation for people who suspect they are infected. 11-23, authorities worldwide have responded by implementing travel restrictions, quarantines, curfews and stay-at-home orders, workplace hazard controls, and facility closures. Many places have also worked to increase testing capacity and trace contacts of infected persons. The pandemic has led to severe global socio-economic disruption. 24, the postponement or cancellation of sporting, religious, political and cultural events. 25, and widespread shortages of supplies exacerbated by panic buying. 26-27, the pandemic has led to one of the largest global recessions in history, with more than a third of the global population being in lockdown. 28, schools, universities and colleges have closed either on a nationwide or local basis in 197 countries, affecting approximately 99.9% of the world's student population. 29e, misinformation about the virus has spread online. 30-31, and there have been incidents of xenophobia and discrimination against Chinese people and against those perceived as being Chinese, or as being from areas with high infection rates. 32-33-34, due to reduced travel and closures of heavy industry, there has been a decrease in air pollution and carbon emissions. 35-36. Health authorities in Wuhan, Hubei, China, reported a cluster of viral pneumonia cases of unknown cause on December 31, 2019, 346-347, and an investigation was launched in early January 2020. 348, the cases mostly had links to the Wuhan seafood wholesale market and so the virus is thought to have a zoonotic origin. 349, the virus that caused the outbreak is known as SARS-CoV-2, a newly discovered virus closely related to bat coronaviruses. 350, pangolin coronaviruses, 351, and SARS-CoV. 352. The current scientific consensus is that COVID-19 has a natural origin. 353, 354, 355, 356. The earliest known person with symptoms was later discovered to have fallen ill on December 1, 2019, and that person did not have visible connections with the later wet market cluster. 357, 358, of the early cluster of cases reported in December 2019, 2/3 were found to have a link with the market. 359, 360, 361. On March 13, 2020, an unverified report from the South China Morning Post suggested a case traced back to November 17, 2019, in a 55-year-old from Hubei, may have been the first. 362, 363. Cases refers to the number of people who have been tested for COVID-19, and whose test has been confirmed positive according to official protocols. 364. As of 20th of April, the countries that made public their testing data have on average performed an amount of tests equal to only 1.1% of their population, while no country has tested samples equal to more than 12.5% of its population. 365. Many countries, for example, Italy and Switzerland, as well as the Netherlands 366, and Spain 367, 368, have had official policies not to test those with only mild symptoms. 369. An analysis of the early phase of the outbreak up to 23 January estimated 86% of COVID-19 infections had not been detected, and that these undocumented infections were the source for 79% of documented cases. 370. Several other studies, using a variety of methods, have estimated that numbers of infections in many countries are likely to be considerably greater than the reported cases. 371, 372. On April 9, 2020, preliminary results of testing showed that 15% of people tested in Gangelt, the center of a major infection cluster in Germany, had apparent immunity to SARS-CoV-2. 373. Screening for COVID-19 in pregnant women in New York City, and blood donors in the Netherlands, has also found that the numbers of infections are substantially higher than reported cases. 374, 375.